because Dr. Gianmarco Gerboni is the reason why I do research in pancreatic carcinoma. He was a very good friend of mine. I was the president of the Italian Society of Diagnostic Imaging. He was my vice president. And I did see this patient, 12 years old beagle, incontinent for the last 6 months, recurrent abdominal pain, and the owner only called between midnight and 2 a.m., always as an emergency. You have some of these? Yes. 3 years ago, he had a prostatic abscessation. Now, he started to have elevation bone and elevation of creatinine. So, I did an ultrasound.
Kidney, ha? Kidney yan eh.
Daw, kidney. Pero meron siyang may
Kidney
ano ko.
abscess.
Parang, oh yes.
I'm on
Nephropathy.
the left side, in the area of the left kidney, and what we are seeing, there is a large cystic or fluid-filled structure. This is a normal cyst. What you will expect in a cyst.
Fluid.
What we think or what we should see in a cyst is very thin, uniform walled structure with water-like content. So we have content
Banay na yung ultrasound.
too echogenic, too many hyperechoic foci, and there is some part of the wall where there is either something attached or is irregular. We touch the flank of the patient and seems like this is very painful. Is a patient of 12 years of age with sign of chronic renal disease. What should we do? A, send the patient to another doctor. B, ignore, but the owner keep calling you at 2 a.m. in the morning because the dog is in pain. There are better painkillers. Maybe we should give the owner and the dog some, CBD. Could you give CBD now? No?
Not yet.
Still illegal. I'm so sorry for you. Especially for the owner, usually work a lot, help a lot. Okay, C, would you take out a full kidney in a patient with renal problem? So what you will do? The kidney function is here, 95 and 1.8. So it's already starting to be too high. The other kidney, it looks quite fine. But really, again, clinical examination, it looks like a lot of these recurrent problems are due to the pain because the renal capsule, any of you has had renal colic? I had. The kidney is painful. Sometimes we have patients with renal problem and it looks like they have a lumbar pain and disc extrusion, but it's renal colic. So I think this is a problem. Can we drain the cyst?
No.
Yes, and in 12 hours will be bigger again. But big renal cyst, and another problem, I'm sure it's not an infection. This dog had 3 years ago a prostatic infection, and usually I shouldn't have such a very ugly content. So what we can do? there are several options. One option that is not really used a lot nowadays, because nowadays we use ablation, but this would be an option. So we, ultrasound guided, put a needle, we start to aspirate the content, this bloody content, but we are under dynamic radiology. Why? Because in the same needle that we use to take out, we put contrast because we want to see if the cystic lesion is connected to the pelvis and then to the ureter. So we put the contrast and we wait for a few minutes. This was Gianmarco. We wait for a few minutes to see if nothing happened. You can also use a still radiograph. Okay. If there is no connection, what you can do, you can inject alcohol. There are several papers, so ethanol or I think it's alcohol. You leave it for a few minutes and then you take it out. Usually like 30% of the content you take out. You want to create a necrosis of the wall of the cyst to avoid that the cyst come back so big. Because this is the only way to solve the problem. Because at the moment that I know, make a surgery to remove only a part of the kidney is not possible. But this is creating a lot of problems. Of course, we are going to culture the cyst and we are going to check. Okay? Nowadays, what we do, we have ultrasonographic ablator. So it's like a needle. We put the needle and we burn the cyst. We empty the cyst and we burn the wall. Or you can use cryotherapy. Again, a needle, but it's frozen. Yes, you put inside the cyst and then basically you destroy the capsule.
Okay.
Same dog, now is actually 14. 1 year later, recheck. The cyst is back, much smaller. There is still a lot of, probably this could be a result of a rupture of part of the kidney, so there is this sanguineous problem, but at the moment it's not giving problem. It still has a chronic renal disease, but it's doing absolutely fine. And the lesion is much smaller than one we saw the first time of this patient. Okay? So ultrasound can be used for a lot of procedures. We do endoscopic guided procedures. For example, I need to collect a mass in the urinary bladder. I can use an endoscopic structure guided by ultrasound. There is a lot of things that can be done by ultrasound. Yes, it looked like it was cortical, but protruding and dilated really the capsule. It's subcapsular. Most likely, part of the cortex was interested, but most of the kidney was okay. So it was really a pity in such an old dog to have to remove. Be careful because cystic neoplasia of the kidney exists, have been reported. I've seen one in 27 years. So they're not really common. Any question? If not, I have a Morenia, a mongrel, 8 years of age.